My name is Ellen, and I'm the Programs Coordinator at Arthritis Consumer Experts. Welcome to the 8th Annual CR Arthritis event at the Canadian Rheumatology Association and Arthritis Health Professions Association Annual Scientific Meeting. Today, I'm joined by Lihi Eder, who is a clinician scientist and associate professor of medicine at the University of Toronto. She co-directs the cardio-rheumatology program, an interdisciplinary program that aims to improve the management of cardiovascular morbidities in rheumatic patients by developing novel models of care and through research and educational activities. She's also the Canada Research Chair in Inflammatory Rheumatic Diseases. Welcome, Dr. Eder.
Thank you, Ellen, for inviting me to talk to you today.
We are very excited to learn more about this intersection where you sit and you do your research. So my first question for you is, as you know, there's more and more evidence emerging around the increased risk of cardiovascular conditions in individuals with rheumatic conditions. How did you find your way here, and why the interest in doing research in this area?
I think it's a combination of many things. It's first of all, I guess the interest in and curiosity to understand what is driving the increased cardiovascular risk that we notice in many of the rheumatic patients that we see in clinic. It's a very complex topic, and there are lots of things that are still unknown, and we and others have shown that there are significant gaps in care. So another thing that have driven me to this was try to improve patient care by understanding more. And finally, it's also a lot of fun to work with clinicians and colleagues from other fields in cardiology, so we can learn a lot from each other. So this mutual work is really great. I really like it.
Yeah, the collaboration and as you said, improving care by understanding kind of the multifaceted nature and how these rheumatic conditions affect patients in different areas that we're kind of learning and tapping into.
Yeah, absolutely.
Fantastic. My next question is, can you share with us a little bit of your workshop? So a little bit of a summary that you led at the scientific meeting, titled Matters of the Heart, Improving the Screening and Management of Cardiovascular Risk Factors and Disease in Rheumatology Setting.
So thank you. So the CRA invited us to have this workshop that I presented along with my esteemed colleagues, Dr. Paula Harvey and Dr. Bindi Korea, who are a rheumatologist and a cardiologist who work in the University of Toronto cardio-rheumatology program, which is the first interdisciplinary program that deals with cardiovascular diseases in rheumatic patients in Canada. So we wanted to share some of the lessons that we've learned over the past years dealing with these issues and educate our colleagues about the increased cardiovascular risk and what are the mechanisms that are driving these cardiovascular diseases in patients. And also, we also discussed the effect of some of the biologic medications. So we know that there are lots of new medications that are available to patients with rheumatic conditions, and it's still not entirely clear how they influence these increased cardiovascular risks in patients. And finally, Dr. Harvey, who is a cardiologist, educated us as to how we can better identify patients that are at high risk and how we should manage their cardiovascular risk factors. This is important information for rheumatologists because many are not very familiar in the approaches to high blood pressure and lipids. So this was, I think, something that rheumatologists and clinicians could apply in their clinics.
Absolutely. And do you mind sharing some of these tips with us that Dr. Harvey shared about helping patients manage these risks?
So I think if it's a little bit different if we're talking that the workshop itself was directed to clinicians, I think if we're discussing this topic with patients, there are a few things that patients can do in order to reduce their risk and manage their risk factors better. The first key point is to be aware. Many patients with rheumatic conditions are not aware of the fact that there is a high risk. So this is the first step, awareness. Being aware is a power, I guess. Patients can serve as their own advocates and discuss these risks with their rheumatologist and with their family physicians, because even among clinicians, there is still a lack of knowledge about this increased risk. So just bringing it up in the discussion is important.
Yeah.
The other thing is not to ignore symptoms. We know that cardiac symptoms may be different in patients with rheumatic diseases because there is a lot of pain and diffuse pain and chest pain. Patients may think, oh, this is because of my rheumatoid arthritis. So it's important not to ignore this and discuss any chest pain or shortness of breath with your physician, your family physician, because there are things to do, and it's important to discover these things early than later on. There are some resources that are available for patients who wants to learn more about these conditions. We specifically have a website which is called cardioroom.org. So there are some, not many, but some patient resources. And the Arthritis Society and the National Psoriasis Foundations also have some information available for patients with rheumatoid arthritis, psoriatic arthritis, so regarding cardiovascular risk. So these are some readily available resources for patients.
Absolutely. We will definitely link those below the video so that the audience can access them. And with that, I would love to know, do you have any wellness tips or that you can share with your patients in practice that you usually use?
So wellness is a big topic, I think.
It's a big topic.
Be with your loved ones, I think, is a general good recommendations. If we're talking specifically about lifestyle changes that are important, I think it's important to be aware that there are ways to help people who are interested in making changes in their diet, in starting to be engaged with physical activity, stop smoking. These things are there, and there are new resources, both pharmaceutical and non-pharmaceutical. So it's easier to do these, to make these big changes with help. Start slowly, I would say, especially with exercise, and discuss managing pain with your rheumatologist, because it's hard to exercise when you have a lot of pain. So there are approaches to address that, and forgive yourself if you know it's hard. So I guess it's also important to remember that small failures are just, bumps on the road, and it's important to try to do even little steps and incorporate them in your daily routine.
That's so well put, and yeah, I think that really resonates with me, because I myself am a patient, and sometimes I'm really hard on myself, like, oh, I didn't eat this well this week, I didn't sleep well, and I get so mad, but that just causes me to be more stressed. And like you said, showing self-forgiveness, taking those small steps, doing what you can. And the first point of being with family, right, and having that social circle and that support is just invaluable on this journey, I think.
Yeah, absolutely. It's
wonderful.
Good in general, yeah.
Well, with that, I do want to ask last question. This year's meeting, as you know, the theme is diversity, equity, and inclusion. And how can we as patients, how can the clinicians, how can everyone on all levels of a healthcare system really incorporate these values, do you think? Big question again.
It's a big question. Yeah, I think there is an increasing awareness of the importance of diversity and equity. For me specifically, I think it's a topic that I'm very, very much interested in, and we need to be aware that there are differences in many patients, and we should try to personalize the approach as much as we can and consider the sex and the gender of the patients and the ethnicities and the values, because there is no one treatment or approach that fits all. So I think in the general medical community, there is increasing awareness, and we should be optimistic that in coming years, this approach will be adopted by most clinicians.
Wonderfully put. Dr. Eder, I do want to thank you for your time, your expertise, and I wish you and the cardio rheumatology program all the best. I cannot wait to see what literature is out there in a few years and how many amazing resources you'll have on the website by then. So thank you again for your time.
Thank you so much, Ellen, for having me.
And to all of our audience, thank you for joining us, and please stay tuned for more from the CR Arthritis Event 2022. Goodbye for now.